You erased my parents' memories, but you didn't get mine. It took me 20 years to find you.
Agent M, we may have a problem in London.
They say you're doing this. How they do where you from? You know it don't start till.
Welcome in.
That's how they do where they from.
And that means everyone and everything on it.
Yeah, baby!
We are the men in black. The men and women in black. Yeah, ha. Perfectly done.
Are you suggesting that we try the most powerful weapon in the galaxy for fun?
Do it. Press the button. Turn it up a few minutes.
We're adding new titles every day to our awesome collection of blockbuster movies. Download the app and subscribe. This isn't just a streaming channel. This is a bold new world of entertainment. Arise Play. Beyond streaming.
Welcome to this week, 60 minutes of analytical review of the big stories, topical issues, and all the controversies around the world. I'm Somna Sambo, and now to the headlines. New sickle cell treatment gives hope for people suffering from the disease. It is the first approved treatment in 20 years. We have a team of medical experts to help us understand it. People's Democratic Party ratifies zoning of its chairmanship to the north, swaps positions between North and South, just as former Vice President Atiku Abubakar wants race thrown open. We have analysis. Nigeria to spend 16.3 trillion naira in 2022 as President Muhammadu Buhari presents budget of economic growth and sustainability to the National Assembly. All right, we begin with the cheering news of a breakthrough in the treatment of sickle cell anemia, in a development that will bring great relief to people suffering from the disease. The United Kingdom has a new drug that has been described as revolutionary and life-changing. Crizanlizumab is described as treatment option for preventing recurrent sickle cell crisis in people aged 16 or over. Arise correspondent Amaka Ude reports.
Sickle cell disease, according to the World Health Organization, is a major genetic disease where the normal round shape of the red blood cells become like crescent moons, leading to blood clots, which can cause extreme pain in the back, chest, hands, and feet. It is caused by mutation in the gene that tells the body to make the iron-rich compound that makes the blood red and enable the red blood cells to carry oxygen from lungs throughout the body. For a baby to be born with sickle cell anemia, both parents must carry a sickle cell gene. It is more prevalent when both parents have the AS blood genotype, which means their baby may have the SS genotype. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become rigid and sticky. Almost 3% of Nigerians are living with the sickle cell disease. It is considered to be the most common genetic disorder in Nigeria. Testing is not available to a vast majority of the infants with the disorder, leading to thousands of deaths every year. Before this breakthrough, there has been no known cure except stem cell transplant, a procedure which requires a donor, and it is very expensive and carries fatal risk. The disease is prevalent in Nigeria, perhaps more than anywhere in the world. The new drug, crizanlizumab, administered by a transfusion drip, prevents the restriction of blood and oxygen supply, which causes a painful episode of crippling pain known as crisis. According to the National Health Service in the United Kingdom, the treatment aims to help as many as 5,000 people over the next 3 years. Doctors are hoping that the drug can reduce the number of times a sickle cell patient needs to go into emergency care by 2/5. This will mark the first new treatment for the disease in 20 years. However, the rollout of the groundbreaking new drug will be a tentative one, and it will be initially only be made available to around 300 patients, but will be extended to 450 in future years. People aged over 16 who suffer from multiple sickle cell crises every year will be eligible for the treatment, but the drug will not be available for routine use yet due to high uncertainty about the long-term effectiveness of the treatment and its associated cost. Many say that although it is a slow step, it is still a step in the right direction that is long overdue to help persons living with sickle cell disease have a much better quality of life.
Right, we have assembled a team of experts to help us understand this breakthrough. And joining me in the studio here is Dr. Ekaite David, a consultant hematologist. Good to have you.
Good evening, thank you.
And also joining us virtually from the United Kingdom is Dr. Baba Inusa, a professor of pediatric hematology and national chair of the National Hemoglobinopathy Panel in England. And also joining us virtually from the United States is Dr. David Ajibade, the Executive Director of the Brain and Body Foundation. Good to have you, gentlemen. Thanks so much. And I'll start with you. This breakthrough has seen a lot of persons across the world, especially people of black origin, being interested on how revolutionary this drug is for sickle cell patients, considering that sickle cell actually affects mostly blacks. What do you think has led to that anxiety? And even, while I was Googling about this drug, I saw lots of people being curious to know the cost in Nigeria, the cost in the UK, the cost elsewhere. Why do you think there's so much curiosity?
Okay, so it is really a great revolutionary breakthrough, and there are several reasons. What the drug works against, which is the pain crisis, the vaso-occlusive crisis, as was given in your summary, is the most common presentation in most emergencies worldwide, even here in Nigeria. It's also the commonest symptom that most people with sickle cell disease present with. And the pains are usually very excruciating, preventing normal daily activities, going to work or doing anything. So if there's any drug that's going to help reduce that, improve the quality of life, it is really a very good option. And considering the fact that Nigeria also has a high burden of those living with sickle cell disease, it really is something to be very proud and happy about.
Very interesting. And I will start with you, Prof. Let's talk about how this new drug will be made accessible to lots of people outside the UK, because the emphasis is on the UK, and of course we know Novartis actually ensured that they got this research done in that part of the world. But there's a lot of emphasis on how it could be made available to those outside the UK. What's your view on this?
I think it's very important that the management and also the use of this drug actually becomes available for patients that need it. And for example, it was actually first approved by the FDA in 2019, and now just been approved in the UK just very recently based on this news. And as a result of that, one expects that the progression for this being available across different countries would be step by step, because it had to depend on a number of factors, including economic consideration. But I think the companies are working very hard to make sure that the drug is not only limited to developed countries, but actually that is available to developing countries. And that is why some of the clinical trials have now been extended into Africa, in Ghana, and also centers in Kenya and also in Nigeria, because when the clinical trials are done in those countries, it makes it easier to introduce the drug. But in terms of the availability and the access, is going to be determined by the individual countries, individual settings because of the cost. But again, the cost is not necessarily uniform. It's very different according to the different countries. So I think it is very hopeful that it's not going to be limited only to developed countries, but Africa would also benefit from this drug.
Very interesting to hear, and it must be cheering news to Africans indeed. And to you, Dr. Ajibade, considering how this sickle cell actually breaks down the body, and most of these people suffering from it are inactive whenever they have a crisis, this could be a very serious relief for them. Tell us more about that.
Yeah, absolutely. This came out 2 years ago. And also, there is actually not the only drug that came out. There's another drug too from the US that was approved. So there are two drugs that are constantly being used now, and I've had different results, heard about different results from it. My challenge, obviously, about two challenges, because we deal a lot with sickle cell disease patients in Nigeria, especially the younger ones, and those coming from remote areas through our foundation. And $10,000 a month, and in this case, about $25,000 to $5,000 a month may be out of the reach. The other challenge is that is only for 16 years old and above. Most kids would we have over 20,000 kids being born each year in Nigeria. Half of them will not live past the age of 5, so they may not even benefit from that drug. But my hopes are up. Hopefully, they'll be able to work out the prices and make it possible to be widely available in Nigeria, especially Nigeria being ground central station for sickle cell in the world. The other problem I have with it is that it's strictly intravenous. So in other words, you have to go to a hospital. The patient probably has to be on admission, and they have to inject it over a period of time. Again, most people who live with sickle cell disease don't always have access to standard hospitals like that, if and when it does come along. But again, our hopes are up for some way that these kinks can be worked through.
Very interesting. He talked about the issue of costs, and this revolutionary drug is one that may be out of reach for so many persons, especially in Africa, even if it's introduced here. Can you tell us how accessible this could be if, for example, people are unable to access it? Could we have maybe donors, foundations, the government stepping in to actually help in the purchase of this revolutionary drug?
Okay, so as we've heard, cost, it's quite very expensive.
And what we want to ask, how much for it?
Well, I just checked online, and like he said, it's about 2,500 per dose, and you're supposed to have like once a month or something. So that's quite expensive, because
as in $2,500
dollars.
Wow,
so in that range to $5,000. So by the time you convert that to Nigeria, that is a lot of money. And considering the fact that a lot of our patients pay out of pocket, it almost cuts out, at least more than 80% of the patients cannot afford. So of course, for us to be able to afford people going on that drug, we would need government, donor agencies, people to come in, because if we leave it to the patients alone, it would be really difficult for them to be able to afford the cost.
Very interesting. And Prof, I would want to come back to you. I just want you to take us through this sickle cell disease and why it's been pretty difficult for a very long period of time for us to actually have a cure, as many expect, because even with this, a lot of people say it's just treatment and not a cure.
So sickle cell disease, just like we had the introduction, the way it's inherited. Again, the fact that when you think about sickle cell disease, Nigeria is definitely the epicenter of sickle cell disease, where, for example, it is kind of estimated that about 150,000 babies are born with sickle cell disease every year. And therefore, it's really a kind of a significant burden of disease in the country. And I'm actually leading a large team of experts working in different parts of Nigeria and some parts of Africa. Particularly, we have a program in Kaduna State, a program that we actually established with Niger State, and actually in discussion with Ogun State as well. because it is important to improve the diagnosis. And it's important for people to know that the baby that is born, when the baby has sickle cell disease, because there are other interventions that can be done that actually can improve the outcome of these patients. Something as simple as penicillin, which is an antibiotic to prevent infections, and folic acid, which they're using to improve the hemoglobin level. But also even malaria prevention are key things that we can really do to actually make a significant impact in the outcome of these patients. And we are saying that a drug like this, why we're actually very excited about a drug like this is that it actually raises the awareness of pharmacy industries, also raises awareness by government to actually pay attention to the generality of the patient with sickle cell disease. And we know that it's not everybody that can benefit from this drug, but actually we know that we do have, it's not every patient with sickle cell disease has the same amount of problems, but also it's not not every patient has the same access to treatment. We have patients in Nigeria who go for bone marrow transplant for cure, as far as India, in the US, in the UK, and also we have Nigerians actually who have access to other forms of treatment. And so the fact that this drug is very expensive in terms of what people are actually saying, we also, in the UK, the cost is actually confidential. But the thing is that it offers access and also interest to actually make research. So currently there are some research centers in Nigeria that are actually among the centers to trial this drug. And if they do that trial of the drug, it actually improves the possibility of those centers actually getting the drug directly from the company for a period of time. But actually long term, like Dr. Kayete has said and David has said, is that there's a need to have a comprehensive approach that includes diagnosis, treatment, and also rehabilitation. And I think the introduction of the bill about sickle cell disease in Nigeria has been a very good attempt. We were involved in this a number of years, but actually it didn't succeed. And currently there are ongoing discussions to try and make sure that there is a bill that provides for funding and actually can help very simple, straightforward interventions like newborn screening, diagnosis, as well as supporting this kind of management.
Very interesting conversation you've got there. And I wanted you to also emphasize on the issue of, a treatment, this drug being a treatment and not a cure. You have been researching on this for a very long period of time. Are we, after the discovery of this treatment now, this drug, are we heading towards a cure for sickle cell?
I think Dr. Kayete may have mentioned that already. The cure we have now is bone marrow transplantation. And actually this happens quite regularly in the US, in the UK, but actually in Nigeria, one of my friends in University of Benin actually had done some transplant in some patients with sickle cell disease who have actually become independent and not requiring blood transfusion. So those treatments are the cure. And then the gene therapy is one that, again, is similar to bone marrow transplant, but slightly different in the sense that you don't get a foreign donor coming to you. It is your cells that are used to actually be injected back into your system. Again, this is an area that's actually very encouraging. And actually a Nigerian patient was the one that was first treated in France, got cured of sickle cell disease by gene therapy. So those two therapies are the main ones which are a cure. But in terms of the treatment, if you live with the patient and have contact with the patient, you know that they actually will do everything to reduce the amount of pain that they're receiving. You have to look at the parents when they look in a desperation and with a child in pain, what else can you do? I also want to mention about what David said in terms of the age 16 and above. The trial that was done in the US was actually age 16 and above. Now there are new trials ongoing, even in Nigeria, in younger children. So it is expected that subsequently we'll have the license actually to reduce the age down to about 2.
Very interesting. And we'll bring you in, Dr. Ajibade, considering that sickle cell is actually a disease that's preventable if both parents actually go to have their tests. What would you say is the most important thing to be done by young people who are about to go into marriage? We've talked about this test being done, but you still see that even in the modern society that we are, people are afraid of doing the sickle test. This test before going into marriage, so to say, and we keep recording the sickle cell disease.
Yeah, that's a big problem. I don't know I know some states have gone as far as mandating what's the word now? Banning carriers from marrying each other. They've gone as far as doing that. I'm not sure how effective that will be, because those same carriers, if they want to get married, they can go to another state and get married. I understand that. But here's the thing. There are over 40 million carriers with sickle cell disease of the trait. So if any of those two get together, they can get married. And they get married, there's still that risk. There's a 25% risk of them having a child with sickle cell disease. The other problem from what we've seen, because we have, through our foundation, we have kids coming in all over from Abuja and around the country asking for help, and we're giving it free of charge, especially for those in remote areas, is that they don't even know. They don't even know that they have about what sickle cell disease is. And so that awareness still needs to be out there. Also, many of these tests, I'm sad to say, are not accurate. Many times they give false negatives. In other words, they say that the person is AA when it should be AS. And they get married, he gets married to, or she gets married, and then they end up with a child that has sickle cell disease. And all of a sudden, people the couple, they're accusing each other of maybe having extramarital affairs because they didn't believe, as far as they're concerned, their test was accurate, they were negative, and now they have a child with sickle cell disease. It's your fault. It's her fault. So those issues are still there. So part of the issue I would strongly suggest is to regulate labs. If you cannot prove you have a specific and accurate diagnostic test for sickle cell, for the sickle cell trait, then you should not be doing that test, because that has caused a lot of heartache and a lot of pain.
You think that is, and I say, how feasible do you think that is?
Well, if they can legislate people not getting married, I think they can go as far as legislating which labs can do a test and which ones.
Yeah, because the thing is that most of these labs are actually regulated, but sometimes you find out that you still have quacks to deal with, and it's becoming a menace. Would you be describing the lab system in Nigeria as needing further regulation, apart from what you have said earlier, or the issues of quackery is one that should be looked into? Because you keep regulating, but there are those who patronize quacks because that's more affordable.
They have a specific list of labs that are recognized to test and approved of to test for sickle cell disease. That may be a good place to start. So everybody knows which labs to go to get these tests. And if they go to any other lab, they know that they can't be sure about the accuracy of the diagnosis.
Very interesting. Let me come back to you, Dr. Kaite. It's been interesting, listening to your colleagues here telling us some of the various issues affecting sickle cell disease sufferers. Let's talk about the issue of this drug itself. And most times when pharmaceutical companies bring an innovative drug like this, they would have to milk the public to make their monies, recover their monies before it's eventually made available publicly. Just like I was told earlier on, he said it's an intravenous injection.
Yes.
So why don't we have it in form of like a pill that could actually be taken? Is it that this is the best way to actually have that in the body? Well,
the research, when they're talking about monoclonal antibodies, when they're creating new drugs, there's a lot of research that goes into it, first on animals, then on human beings. So one of the important things is maintaining the substance. It's a monoclonal antibody. So you want to maintain it in such a way that when it gets to the person that needs it, it is still active. So I can't hold brief for them, but maybe their tests have shown that the best way to keep it active and keep it the most viable is intravenous. So the only thing that it then means is that for a sufferer to get the drug, you would have to get to a healthcare facility. The good thing about it is that a lot of tertiary institutions have hematologists and pediatric hematologists, and those are those who manage sickle cell diseases. The good thing about it is that secondary centers like general hospitals are also having recruiting hematologists. So as the numbers of the doctors who can manage increase, then we will also be able to provide better service.
Now let's talk about the pharmaceutical companies actually milking, people out of this kind of innovative drugs.
Well, I can't hold brief for them, but a lot of money goes into research. But apart from that, we must say that some of these pharmaceutical companies also do some form of corporate social responsibility. So you will find out that after some time, they start to do some price regulations and price shifts and things like that in such a way that it favors and benefits the patients eventually.
Very interesting indeed. As we try to round off this conversation, I would like you, Professor Inusa, to talk about sickle cell disease in this period of COVID. How has it been for people who have been suffering the disease?
COVID has presented challenges to patients with sickle cell disease, and in different countries have been different responses. So in the UK, for example, there has been what they call shielding, whereby patients were not allowed to actually go out or providing food for them in their homes so that they don't get in contact with sickle cell disease. But our major concern was that because sickle cell disease, the way it presents, it affects the chest, it affects the kidney, and COVID does the same. So we said patients with sickle cell disease get that, then the consequence can be very, very severe. And that was why that was our main attempt. But now it's important to make sure that sickle cell patients get the vaccine. And I know all the complete controversies about vaccine hesitancy that is not only limited in the UK. I'm Nigerian. I go to Nigeria and also know the anxiety that people have about the vaccine. I think we really recommend and encourage patients with sickle cell disease to get vaccinated, because that is really one sure way of actually preventing them actually coming in contact with COVID. I think it is so important to do that. And just a comment about the pharmaceutical companies. It's exciting that, for example, a company like Novartis actually have started programs for cheaper drugs, hydroxyurea treatment in Ghana, in Kenya. And guess what? They're actually trying to reach to Nigeria, and they just need to have access to be able to get to the ministry to make a pitch.
All right, very interesting indeed. We must thank you so much. Professor Baba Inusa is Professor of Pediatric Hematology and National Chair of the National Hemoglobinopathy Panel in England. We must thank you for joining us. Also, Dr. David Ajibade, the Executive Director of the Brain and Body Foundation. And of course, I've had in the studio with me here Dr. Ekaete David, a consultant hematologist. Thank you all for joining us to help.
I know. I want in. You erased my parents' memories, but you didn't get mine. It took me 20 years to find you.
Agent M, we may have a problem in London.
Dance how you doing this dumb. How to do it where you from? You know it don't start so.
Welcome in.
That's how to do it where
That means everyone and everything on it.
Yeah, baby!
We are the men in black. The men and women in black. Yeah, perfectly done.
Are you suggesting that we try the most powerful weapon in the galaxy for fun?
Do it. Press the button. Turn it up a few.
We're adding new titles every day to our awesome collection of blockbuster movies. Download the app and subscribe. This isn't just a streaming channel. This is a bold new world of entertainment. Arise Play. Beyond streaming.
Welcome back. You're still watching This Week on Arise News. I'm Somna Sambo. It is now a done deal. The position of the national chairman of the People's Democratic Party has been zoned to the north. The 94th National Executive Committee meeting of the PDP has ratified the Governor Ifeanyi Ugwuanyi Committee's recommendation on zoning of party offices. The party, however, remained evasive on the 2023 presidential ticket as party leaders resolved to debate the Governor Bala Mohammed-led committee on the review of the performance of PDP in the 2019 presidential election. The Bala Mohammed committee had recommended that the presidential race be thrown open to PDP members, regardless of their geopolitical zones. The zoning of the national chairmanship to the north is likely to open door for the presidency to be zoned to the south. Although some party members, including former Vice President Atiku Abubakar, have expressed dissatisfaction with this arrangement, this has further thrown open the debate on zoning across the country. Let's listen.
There is no such thing as a president from southern Nigeria or a president from northern Nigeria. There is only one, a president from Nigeria, for Nigeria, by Nigerians. This country has a sense of fairness. This country has a sense of justice. This country has a sense of fairness.
All right, joining me now is Professor Jideofor Adibe of the Department of Political Science and International Relations at the Nasarawa State University. We will be talking on these issues generally as it affects the polity. You're welcome, Prof. Yes, so the political weather was heightened during this outgoing week where we had the PDP finally resolving this teething issue of how to zone its party offices, and they've already done that now, and a lot of analysts say it shows how the party may likely present its presidential ticket in the 2023 general election. And this has also put pressure on the All Progressives Congress to also see how a chairmanship seat is given to the north, so that the presidential candidate of the party will come from the south, and so there'll be a south-south between the two biggest political parties. What's your assessment of this political gymnastics, as some people call it?
Well, thank you very much, Sambo. The first thing to understand, let me just take one thing that I read quite a lot. When people say it is unconstitutional, that's actually a misnomer, because when you say something is unconstitutional, you are implying it is illegal. The fact that it is not in the Constitution does not make it unconstitutional. You just say it doesn't in the, and anything that is not in the Constitution is probably allowed. So the idea of zoning and power rotations are part of the contrivances that are used in nation building. So politicians should stop giving the impression that yes, but the politicians are politicians. It's illegal. No, it's not illegal. But even when they say unconstitutional, yeah. If you say something is unconstitutional, you are implying that it breaches either the spirit or letter of the Constitution. It doesn't in this case. They're just trying to tell you, they probably want to say it is not a constitutional provision. It is a party arrangement, which is true. But these are just contrivances to supplement the instruments that are in the Constitution for nation building, like federal character principle. So that's, if we get it out of the way, then we also have to understand two other things. One is that politicians are politicians. They are in this thing for, you know, despite what they say, they have to serve their interest. Even the southern politicians that are insisting that the power must rotate, many of them, when they go to their states, and there is governorship election, and they have power rotation and zoning arrangement, they will say it doesn't apply. So it just depends on where. It's very interesting because with due respect to the former vice president, you know, in 2011, 2010, 2000, there was a huge controversy about the zoning arrangement. Yeah, and power rotation. Huge clamor for the presidency to return to the north. Yeah, because Jonathan was going to contest in 2011, and the whole sword of the north believed that it amounted to cheating the north. Actually bought that idea. I was opposed to Jonathan running in 2011. I said it was going to, you know, upset a gentleman arrangement between the two blocks. So Politicians are politicians. When it doesn't favor you, you have to say what you have to say. But I don't think, I think also both the North and the South, what they are doing now is horse trading. They raise the start and then they engage in negotiation. The people that are involved are too much vested in the system that they can't afford the system to unravel.
Now, Prof, there's always this clamor for zoning whenever it comes to election period.
Yeah.
If it favors the North, they will say, no, we don't need zoning any longer. It should be based on merit. And if it favors the South will also keep saying, look, we should focus on merit. What's the place of merit in politics?
No, merit, what's zoning and power rotation, there's just a slight difference between the two concepts. They are not incongruous. They do not contradict the idea of merit.
And can you help us understand?
Now, for example, I say, when you say zoning, it means particular political offices are located to particular areas to the exclusion of others. Now, if it says South, then there is also micro zoning arrangement. Within the South, they have to agree among themselves which part of the South. And then you have to bring out somebody that other members, because if they say South, it doesn't mean you are going to stay contest among others. For example, in 1919, Olufale was there against Obasanjo, and probably there were other things, Ekwuemeran against Obasanjo. So you still have to come up, and people with your zone will then select somebody they believe is more competent or more acceptable to the generality of Nigerians. So it's actually not proper to start arguing that it contradicts the whole notion of merit. The other thing I wanted to point out is when you say rotation, it simply means certain political offices will have to move between agreed zones over a given period of time. So they are similar, but not exactly the same concepts. Okay. And there is no part of this country that does not have competent people. And when we say zone, don't forget, you are talking about a big area. So what we probably will be clamoring at this stage in the nation building process, if you are going to run for office at your age and you want to think, I have to respect this zone, you calculate that before it comes to your zone again, you probably will be walking.
And that's why people are saying that zoning excludes merit, because there are lots of competent persons from all ethnic groups, not one particular section of the country and all of that. And people say, we've been doing this zoning for a long period of time, doing these rotation issues, and it still doesn't give us the best leaders. So do we really want the best leaders, or we just want people who are chosen from different political
because
zones?
You are capturing it from a particular zone, that it doesn't promote merit. There is also, in a sense, in which actually it promotes merit, if it promotes competition. If, for example, it is the turn of the North, and they are going to tell you, oh, well, we have to put our best foot forward, because if we don't do well, they're going to castigate us. You can also look to competition. I don't think there's any part, but it's just that politicians are politicians. And it doesn't matter whether from the North or from the South. They are just different ethnic and religious factions of the same elite.
Now, with this decision by the People's Democratic Party, do you think it positions the party very well on a sound note ahead of its national convention at the end of this month, to prevent chaos among contestants and all of that, to bring reconciliation and then prepare the party ahead of 2023 when they'll be having their national convention to elect a presidential ticket?
Let me say this thing. I foresee a situation where both APC, I'm talking about them, they will have to zone their candidates to the South. That I foresee, I'm predicting that. Why do I say that? In 2015, the PDP zoned the presidency to South, and Jonathan contested. And in 2019, they zoned it to the North, and Alhaji Atiku, was the flag bearer. So it also makes sense that in 2023, they move it to the other side.
But if you look at the number of tickets that have been given since 1999, the South has had 4, and the North has had 2. Beginning from 99, Obasanjo had in 99, 2003, and then in 2007 it went to the North, and then in 2011 it went to the South, in 2015 it went to the South, and then in 2019 it went to the North. So it's like 4 against 2. That's what people are saying in the party.
If you bring that argument, you remember the time of MKO, one of the reasons he won was that there's this huge sentiment similar to what we have here in the South, that they say, look, through the instrumentality of the military, the North has dominated the political machine. So it has to come back. It doesn't really matter Muslim or Muslim. So they close rank. So for example, in the Southeast, even though you have Sylvester Ugo as the running mate, to Tofa, he lost because the tendency there, look, and it tells us a little about identity construction, that identity that is perceived to be under threat will always be the one most vociferously defended. And that you can see now, the Northerners, you can see even the Benue State governor, they close rank to defend Northern interest. But what I see happening is, it is part of the negotiation, it's part of brinksmanship.
Although the Benue State governor actually voted for the South to have the chairmanship of the PDP. In this instance, I want us to talk about identity politics and how it may affect, the polity in 2023. A lot of people are, talking about how it's the time of Igbos, how it's the time of Yorubas, how some people are saying, look, we still have to continue this democratic journey with the North after these 8 years, because if you look from 1999 till now, the South has had more chances than the North.
Well, if you look at it, there will always be arguments. That was when Remy, not everybody will buy into a particular argument. Even in an Anambra election before, people will oppose. If you go there, people will also go back to from 1966 to a long period where the North dominated the political machine.
Very interesting.
It is also interesting that some people can now say, oh, Yar'Adua didn't complete his tenure, we want our own. So you stretch the logic to whichever will benefit.
And I mean, that's the identity politics I'm talking about.
That is
when they are talking of democracy, the North will say since 1999 we've been shortchanged. So but when you look at the entire thing, you see that the North has had more power than the South.
If you change it. But if we start from you just have to look at the political parties at the dispensation. If you say, okay, PDP, you gave it 2015 to PDP, to the North, 2019, 2015 to the South, 2019 to the North. Logically, you say 2023 move. Now you go to the APC and say, now Buhari has taken 2 terms.
Yeah.
8. Are you going to succeed again? And so there is always
logically you get the answer staring at you.
It's just like in statistics, depending on the outcome you want. You have to change which one is your base year. You change the year, and then you get a different outcome.
Very interesting Nigerian politics indeed. I just want you to talk about how well positioned these political parties are. The 2 major political parties and other political parties ahead of 2023. Do you think that the focus is on what they could do for Nigerians, or this zoning and no zoning issue has distracted people from what they will be offering the people?
Let me tell you, Sambo. Politics is a context between discrete entities. There are group dynamics in politics. It doesn't really matter anywhere in the world. That was why when Obama won, the black people were clamoring. You cannot, anybody saying, oh, we don't want to think of it. There's nowhere in the world where it exists. So identity will be part of it. The issue is, how is it managed? How is it managed? I think in the process of nation building, and I think the generality of even the people in the North who believe that the atmosphere is not conducive for somebody from the North. And I can tell you what they are doing. I want to bring what Hakim said, and because I understood
very quickly, because
I understood what he said differently when he said whether in the North, whether we are president or vice president, will continue. This is a response to people in the streets who are trying to say, oh, the South, presumably they hold the political, economic power, and we have political power as a lever. So if you give them political power, they are going to use it to, become hegemonic and try to impoverish us. So by telling them, look, even if we are VP, we will still be there.
Very interesting analysis we've got there. We have to go on this short break. When we come back, we'll continue the conversation, and we'll be focusing on the budget 2022 that was presented by President Muhammadu Buhari at the National Assembly. Stay with us.
I know. I want in. You erased my parents' memories, but you didn't get mine. It took me 20 years to find you.
Agent M, we may have a problem in London.
They say you're doing this dumb. How to do where you're from? You know it don't start till.
Welcome in.
That's how to do where it's from.
That means everyone and everything on it.
Yeah, baby!
We are the men in black. The men and women in black. Yeah, ha. Perfectly done.
Are you suggesting that we try the most powerful weapon in the galaxy for fun?
Do it. Press the button. Turn it up a few.
We're adding new titles every day to our awesome collection of blockbuster movies. Download the app and subscribe. This isn't just a streaming channel. This is a bold new world of entertainment. Arise Play. Beyond streaming.
Right, welcome back. As the country moves towards 2023 general elections, security is undoubtedly a major concern to the President Muhammadu Buhari's administration. As this is evident in the 2022 budgetary allocation, President Buhari presented a 16 trillion naira budget for 2022 to the National Assembly, with defense and security getting 15% of the budget, followed by infrastructure, which got 8.9%, and education 7.9%. But much to be worried by Nigerians is the rising debt of the country. The Minister of Finance, Budget and National Planning, Zainab Ahmed, while presenting the budget breakdown, however, said revenue is not the biggest, revenue and not debt is actually the biggest challenge of the government. Let's listen.
Some have expressed concern over our resort to borrowing to finance our fiscal gaps. They are right to be concerned. However, we believe that the debt level of the federal government is still within sustainable limits. Borrowing at specific strategic projects and can be verified publicly.
All right, President Muhammadu Buhari there explaining that issue of revenue. And I still have with me in the studio Professor Jideofor Adibe of the Department of Political Science and International Relations at the Nasarawa State University. And I'm now being joined by Barry Avotu Johnson, who's the National Chairman of the Nigeria Youth Democratic Party. Welcome, gentlemen. Let me start with you. What's your party's analysis of the 2022 budget, which the President has said is of economic growth and sustainability?
Well, thank you for having me. I would like to start by saying this is the first time that the President of Nigeria in an APC government is providing the opportunity for a fast presentation budget to the National Assembly. And for him to have...
He did same in the 2021 version.
Yeah, but the timing is different. What we are looking at is a budget that should contain the youth's activities in it. Politics, budgetary, in economic recovery, and all of that. So we are looking at a budget for 2022 that will have something to do with the development of our people. We are more interested in credible democracy. Democratic education. I mean by giving the youths the opportunity to participate in the electioneering process, and so doing it will help in coping down the activities of juvenile delinquency in our society. Because most of the people who participate in kidnappings and banditries, they are youths. So by the time the budget...
What's your analysis of the budget for youth as presented by President Buhari?
Well, for now, we actually cannot say that it is positive. We have not been given the opportunity to give analysis to it because it's not a, let me say, it's not already a public document that for now it's still a proposal.
The president says he's focusing more on social investments where we have lots of Empower for young people and all of that. So let's come to you, Prof. The president is giving this budget, which is his last full budget that he will be implementing before he goes, because in 2023 he will only have opportunity to implement half. Has this budget just become a ritual that doesn't have effect on Nigerians at the end of the day? Because we've seen last budget 13 trillion and now this new budget ballooning from 13 to 16 trillion, and people are just asking, what's in it for us?
Well, let me just put it the other way around. When you convert that 16.89 trillion or thereabout into dollars, it's roughly 39.89 billion. And that tells me that when Nigerians work with a swagger, we should just be a little bit more sensible, because the budget, remember that's a proposal. Our own revenue is about 10-point-something trillion.
10.1 trillion.
Now, this is the entire budget of a country. Now, the revenue for Microsoft in this 2021 was about 168 billion.
US dollars.
That of Facebook was about 87 billion. So it simply means when we are calling ourselves rich countries and we work with this big swagger, and when we convert this, you see that so many boroughs and equivalent of local government areas in advanced countries are richer than you. So it gives you a sense of proportion. Having said that, I want to say if we use the percentage sectoral allocation as an indication of government priorities, you say, well, they've done reasonably okay. Defense and security has 15%, infrastructure has 8.9%, education has 7.9%, and then health. I think this shows some kind of preferences. However, if you also see that he has to borrow about 5-point-something trillion, to
6 trillion,
almost to do this, and then put it that in the first 5 months of this year, we were using 98% of our revenue to service debts. Then you get worried. I was actually worrying about it. Then I started to think, say, what of that? Maybe Buhari is even smart in a way that we're not giving him credit. What if he believes that this will not be repaid? Because no country actually has repaid all these things. What if he's just borrowing and then hoping that, like what happened in the 80s and 90s,
we'll have another debt,
there will be another
forgiveness.
He started even by saying it in the UN.
Yeah,
Is it possible that, because when we talk about responsible borrowing, you also have to talk about responsible lending. Yeah. So that at a point when you say, I cannot pay, just like in your banks will put in place measures to make sure that you have the capacity to pay back. And the government keeps on throwing this thing about debt to GDP ratio, which is 23%. Yeah. What they forget to say is that the debt to revenue ratio is what we should be coming. Our own debt to revenue ratio is about 7.9. The average in sub-Saharan Africa is about 12%. Globally is about 29%. So we also be talking about our
interesting. Now let me ask the politician in the house, when you see Buhari budgeting 100 billion naira for INEC to start preparing for 2023 election, and then he's also saying that he has budget monies for the population census next year, what do you think all of this is all about? And how feasible do you think, for example, the census will hold next year, considering that several ones haven't held since 2006?
Well, for me, I don't think the census will work, because we had a chairman who was appointed during the Goodluck era, and he came up and said there have never been any census in Nigeria, and he was advised to resign. That is somebody who has integrity in his business and in the business of the activities of everything. So I don't see a practical census happening where there is no peace in the country. These are issues we cannot just put aside.
So the government actually got it wrong by saying that we should do a census.
Yes,
when
Nigeria is not peaceful. We are only working hard to make it look peaceful.
But the government gave more money to defense.
More money to defense, but we are not seeing the actualization of the usage of the money.
Okay, very quickly, Prof. The issue of census in less than 60 seconds.
Well, every government wants to put it last because it is contentious. For as long as population remains a key criterion for revenue allocation, it is going to continue to be contentious. It's not only for revenue, it's also for allocation of seats in the Federal House of Representatives. So it is part of the politics and highly contentious. So no government, even Obasanjo, you put it towards the end of your regime so that if anything happens, you're already going.
Yeah, you just run and leave the problem for the next president. Yeah. All right, just very quickly, are you are you considering that INEC will be able to hold very credible elections because of this 100 billion that's being made available to it before that election period, unlike in the past?
Well, for my party, the NYDP, I think we don't believe in INEC for now. And the reason why we don't believe in INEC, you see, when we the youths are talking, you people laugh over what we say. But we are always saying the truth.
I'm afraid we'll have to say this some other time because I've been told my time is up. Well, that's how it's been for this edition of This Week from me and the entire team here in Abuja. Goodbye and thank you for watching. We've had Professor Jide Ofor-Adibi of the Nasarawa State University and then Barry Johnson of the National Youth Democratic Party. Thank you so much. Nigeria Youth Democratic Party. Thank you so much and see you next time.
Thank you.